By now, we know that human metapneumovirus HMPV is not comparable to SARS-CoV-2. It's neither novel nor capable of causing another pandemic. However, it still remains an important respiratory pathogen, especially for infants and elderly. To discuss this virus, I have with me today Dr. Saumitra Das, who is a virologist. He is also a professor and chair at Microbiology and Cell Biology Department of Indian Institute of Science. Also, he is co-chair at INSACOG Advisory Board. INSACOG is a pan-India network to monitor genomic changes in SARS-CoV-2 virus. Thank you, Dr. Das, for joining us today. Who knows virus better than you? So, what do you think that public should know about HMPV?
First thing, I would just say that this is, as you mentioned, that it's not novel. There is no reason to panic. Unlike SARS-CoV-2, we have seen this virus before. Actually, it was reported in 2001 in Netherlands, some infant patient and who had this kind of acute respiratory illness, ARI kind of symptoms. And from then, it has been being actually monitored and it never really had any outbreak since 2001 until now, what actually China has reported. This is very similar to human RSV, which is human respiratory syncytial virus. Actually, that also, causes similar kind of symptoms. Actually, what happens is essentially it shows up with the common cold symptom, and then slowly it gets into bronchiolitis. And in certain cases, depending on the individuals, it might lead to pneumonia kind of symptoms, particularly in the older ages. So, and as I mentioned earlier, it's essentially the infants and the old people, they are mostly the vulnerable populations for this particular type of infection. But, if you really compare it, it is very similar to whatever we call is like influenza-like illness, ILI, or SARI, which is, severe respiratory acute infection. Those kind of symptoms are matching with this. It has no match with the SARS-CoV-2 so far. And so what actually I read it from a different literature, the treatment is also mostly symptomatic at this stage. So, if somebody have this cold, then, whatever we just treat ourselves, that we should be careful that we should not spread it. I mean, that's very important. I would like to share here that, this is every festive season, we have experienced this kind of a cold, and, SARS-CoV-2 also we have seen all this new wave actually started during the Christmas time, starting from 2019 till now. I think every year, this Christmas and New Year Eve, there are a lot of mixing with the people, and people somehow unintentionally ended up spreading the cold. And, some of them are actually SARS-CoV-2, some of them could be some other flu viruses. So one has to be careful about this. I mean, how would you make yourself careful is essentially, if you don't have a mask, at least you use handkerchief to cover your nose and mouth. And also you need to sanitize your hand so that you don't really get contaminated.
Absolutely. So, definitely, we understand that there is no need to create an alarm or be in a panic mode. However, you need to take care, and especially people who have infants at home or elderly at home need to be little careful. And so, possibly this could be the reason why this HMPV was blown out of proportion, because this was the Christmas time, New Year time, the same time that when we detected SARS-CoV-2, and then China was there. So I think these were the two coincidences because of which HMPV gained a lot of spotlight. Dr. Das, so do you think that we have enough surveillance mechanisms in place to monitor the spread of HMPV, if there is any, when we compare to the strong surveillance mechanisms we used to have for COVID-19, and even now we have for COVID-19?
Right. Two things I would like to mention here. Number one is definitely the IDSP network in India, and also ICMR centers. They are already having a routine surveillance along with the all these respiratory viruses. They check it. what I heard actually, this is included in some of the commercial respiratory virus panel. So it's being detected. I don't think at this moment sequence verification is that necessity. If it comes to a point that there are a lot of variants are showing up at this moment, there are two major genotypes. What I read from the literature is the genotype A and genotype B, and within that they have A1, A2, and B1, B2. But there are some reports they are claiming that in India we have genotype A 2.2.1 and 2.2.2, but I am not sure how often that is actually found in our populations. That needs to be checked. But if required, we have this INSACOG network, as you mentioned in the beginning only, that can be actually activated with the appropriate authority approval, and that can be always get into action to have a sequencing done. But other than that, there are always detection methods are in place. There are RT-PCRs for this. There are ELISA-based detection available for this particular virus detection. That can be continued until there is a requirement for the sequencing for this. But anyway, we are keeping an eye, and then if the government wants us to get the sequencing done, then we'll try to see how fast we can get those things done.
Doctor, are there any studies which tell us that any of these strains or genotypes that you were mentioning are slightly more lethal or need to be concerned about?
So far, I'm not aware of any such of those variants that has emerged, which is more lethal or more dangerous in terms of infectivity and all. If you really compare the infectivity, SARS-CoV-2 was much more higher infectivity compared to this one. But people should be always alert, and then we should be always careful to check whether something is emerging or not.
Right. And so when we are already talking about the variants and diseases, so let me ask you that what is the status of COVID-19 in India right now?
See, COVID-19, if you really check the government sites, it looks like there are very less reporting. I mean, I don't know how often it's being detected. There are only 4 active cases. I just checked it at this moment. So, but most of the cases we are not worried because it became like another flu-like disease. So people know how to handle it. So they are not coming for diagnosis. And unless they come for the diagnosis, there is no way we can actually detect it. The routine surveillance is going on. I mean, still the international travelers are randomly checked. I think 2% of the international travelers are checked for randomly to check for SARS-CoV-2. So those things are being placed. But the routine checkup, it's not actually necessity at this moment, and that's why we are not continuing. I guess, but I'm not too sure about it. But I don't think that is something to worry about at this moment, SARS-CoV-2.
So will it be right to say that COVID-19 has also evolved into a common cold virus?
Yeah, I mean, I can't really give you a statement like that, but what I would say that you have to keep it in mind that majority of our population is now vaccinated. So even they are infected, we don't anticipate that the severity will come to that stage that it needs his hospitalization or other things. Maybe infection will happen, but it won't cause that much of damage because there will be much more resistance from the vaccinated individuals. So in that way, I think we are a little safer. And I would say that we will be able to handle it by symptomatic treatment.
Okay. So coming back to HMPV, when we do sewage surveillance, do we keep on finding the samples from HMPV virus as well, or we don't include it in the
No,
list of the pathogens that
see,
we are looking for?
part of that sewage surveillance plan was to sequence and then find out for unknown pathogens. And those sequencing things are actually going on, but we are trying to scale up soon. But we have some of the units which are functional, and if necessary, then we probably jack up those surveillance and try to see whether we can detect the presence of HMPV in different sewage sector. Again, depending on what the government wants and whether the appropriate authority approves that, and if they demands it, we have system in place to work out those.
So we can safely say that we have all system to monitor HMPV are in place, and whenever there will be any need to do that, we can easily increase our capacities to monitor HMPV even more closely, right?
Right.
Right. So, what will be your final word of suggestion for our viewers, sir? Considering that there is a lot of panic around this virus, unnecessary panic, I would say, but still, what would be your words?
Now, I would say that, this is a festive season. I mean, this is the beginning of the new year, and then people are in festive mood. I don't want to spoil that, but people should be like little alert and then protect themselves and protect others by covering, as I said, at covering with the mask or by the handkerchief, and then try to avoid direct contact with the people who are already having cold, because you don't know whether they're having flu or they're having some other disease at that moment. So that's essentially we need to do. And in case somebody is sick, I think we should take symptomatic treatment. And if that doesn't help, definitely you should consult a clinician and get an appropriate treatment.
Great. So now we have understood that HMPV is not capable of creating another pandemic. It's not comparable to SARS-CoV-2 as well. However, it would be wise if you will take care of yourself, considering that this is a common cold or flu virus. But still, if in case you have infants or elderly at home or people with some sort of medical history, then you should use the standard precautions that we all have learned taking during unfortunate COVID-19 times. Thank you so much for watching.
Right. Thank you.